When I do a consultation with somebody and they come in and they kind of tell me their story and tell me what they're looking for and kind of share with me their frustrations about the state that they're in, and then we as a team get to watch them over the weeks and the months get better and get back to those things that they couldn't do, that's really powerful. My name is Diane Updahl. I'm the lead physical therapist and practice manager here at Wellspring Health Center. Our approach, I think, is different than a lot of traditional physical therapy. We're a little bit outside of the box. It seems like a lot of people's experience with physical therapy is that they go, they get evaluated, they're given some exercises to do, they're seen for a few visits, and that's their whole experience with physical therapy. We're kind of the complete opposite of that. We know that people may not necessarily do their exercises at home. And if they do them, we don't know for sure if they're doing them correctly. So if they do them incorrectly, they're sort of precipitating the problem to continue. So we take more of a hands-on approach to things. So it's pretty typical for us to see a patient over the course of, say, 3 or 4 months for treatment a couple times a week. One thing we keep track of is their pain levels, but that's not really all we care about. We care about, like, are they functioning again? How are they doing in their life? So it's not all about pain. When patients come in, we set goals with them, like, okay, what are the things that you can't do now that you want to be able to do again, or want to do without restriction or without pain, that kind of thing. Part of what we do is exercise-based. A lot of the work we do there is Pilates-based. So in the evaluation that we do, we figure out what is off in the body. Where are they weak? What does their posture look like? What does their core strength look like? How flexible are their hips? Like, what's going on? And we may be looking at an area of the body that isn't necessarily where they have pain. So from an integrated standpoint, we also provide medical services along with our physical therapy. We have a nurse practitioner on staff. We treat some younger children, teenagers, up into people in their 80s and 90s. It's basically anybody who is having difficulty doing the day-to-day things that they love to do or want to do. We see a lot of people that have lost a lot of hope. They've kind of done everything. They've tried to be down the medication route and didn't like that. Maybe they've had imaging, maybe they've had surgery, or maybe they've been recommended to have surgery and they don't want to go down that route. I think because of how we do things and we see people over the course of time, and we can provide leadership to that patient over time as a team. So we provide kind of an alternative source of ways to get them to a better place. I think it just gives us a sense that we're actually really helping people.